I am Nahid Kabbani, and this is the Lighthouse for today's viewers. Welcome to our show. New American Media hosted a press conference recently to announce for ethnic media the latest of the study about preteen health issues. And I had a chance to tape it for you, and the director of the New American Media, Miss Sen. So let's watch it together.
I'm Sandy Close.
So let's watch it together.
I'm Sandy Close. I'm the executive director of New American Media, and this morning we're helping the Centers for Disease Control and Prevention and the American Association of Pediatricians launch a very important campaign to inform Americans about the importance of pre-adolescent healthcare checkups and vaccinations. It's an age group that often gets lost from sight. 11-year-olds, 12-year-olds. It's not something you automatically think of the way you do about taking a baby or an infant for a checkup. But 11 and 12-year-olds, just before they're entering adolescence, get booster shots and get vaccinations that really protect their health against some debilitating diseases. This is what the Centers for Disease Control is going to talk about today. Yesterday in New York, we were really honored to bring ethnic media together to meet and talk with experts from the Centers for Disease Control and Prevention and the American Academy of Pediatricians to talk about the campaign they're launching as of August 1st to raise awareness of a critical age group that often gets ignored or forgotten about when we discuss health issues, and that is 11 and 12-year-olds who are just entering puberty, who are just beginning to enter adolescence, and who have the opportunity to get vaccinations that would immunize them against some very debilitating illnesses, that also need checkups that could help them and their parents understand what the new phase in their life that adolescence represents could mean for them. And I, as a mother, sons were 11 and 12. I absolutely didn't have sons were 11 and 12. I absolutely didn't have a clue. I thought as soon as they were babies and infants and I had gotten them with all their vaccinations, I was over and done with it. And I didn't have that clear sense that I learned yesterday. So I think in terms of two areas that we cover, news you can use, healthcare news that is really of service to our audiences, and secondly, just general understanding of the role of the Centers for Disease Control and Prevention, the preeminent government agency charged with preventing and protecting public health, not just in the United States. This is another thing I learned yesterday, but internationally. They play a role with global health, and when I introduce the speakers, you'll see their experience extends around the world. So very much for our purposes, very great speakers for us because they know the home countries that many of us also come from. This is also, I think, for us, New American Media, the first time the Centers for Disease Control has really expressed an interest in reaching out to all the ethnic media, Hispanic and also Asian and also Arab and also Middle Eastern, generally Eastern European, the whole African, the whole spectrum of populations that ethnic media serve. So really valuable as they are mounting this campaign to raise awareness for all Americans about this important age group and what they feel is vital information for protecting the health of pre-adolescents. So our first speaker today is an assistant attorney, surgeon general, excuse me, assistant attorney general, no, we don't want to go there. Too controversial. She is an assistant surgeon general with a very impressive resume. The resume is in your press kit, but I just want to highlight one or two things. She's the director of the Centers for Disease Control and Prevention's National Center for Immunization and Respiratory Diseases. She was named an Assistant Surgeon General of the United States Public Health Service last year in 2006. Her resume includes major experience overseas. She worked in West Africa on meningitis vaccine studies, in South Africa on a variety of projects, in China on SARS, emergency response, and indeed she's a visiting professor for the Beijing Centers for Disease Prevention and Control. And you can reference her resume in your press kit. I'm going to introduce each speaker when they start, but we'd love to start with you. I also want to welcome our local healthcare experts. And could you just mention who you are so that people know if they have to leave before we get to the discussion?
Sure.
Dr. Shuhat.
Great. Well, thank you all for being here, and please let me know if you can't hear me, because sometimes my voice drops off a little bit. Most people are really familiar with immunizations, but most people think that immunizations are for babies or tots, that shots are for tots, and they end at the beginning of school. But actually that's not true anymore, that there are immunizations for older children as well. Today we want to highlight the idea that it's very important for parents to make an appointment for their 11 or 12-year-old to have a preteen checkup, to have a visit with a doctor or nurse about what's going on today and what's going to happen in the next many years to come. So my colleague, who's a teen health specialist, is going to talk a little bit about what's involved in that preteen checkup, what are the issues besides immunizations, why is it good to have a visit at that point in a child's development and growth before all of the drama of the teenage years starts to happen. I look around and think a lot of us know what that drama is all about, but 11 and 12-year-olds are often still getting along well with their parents and able to talk about things. And so that visit is a first time where the doctor meets with the parent and the preteen, but also tries to have some confidential time with the preteen to get used to that. And you'll hear more about that in a few minutes. So I'm going to focus on immunizations and what it is that we can offer children when they're 11 or 12. First, I want to give you the sort of big picture. There are 3 different vaccines that I'm going to talk about. 2 of them are routinely recommended for all boys and girls at 11 or 12, and the 3rd is routinely recommended for all girls at 11 or 12. So I want to tell you a little bit about the diseases that those 3 vaccines can prevent, why we think prevention is better than getting the diseases themselves, and what else parents might need to know in order to answer their key questions. And I'll try to make this quick so that you have time to go into some of the questions you have for your own communities. First, I want to talk about meningitis. The vaccine involved is called meningococcal meningitis. In your press packet, there's some more details, so some of these things are spelled out, but that vaccine is meningococcal. So it's the meningococcal vaccine that prevents meningitis, meningococcal meningitis. Meningococcal disease and meningitis is probably the most scary infectious disease. It can take a healthy teenager who's playing outside in the afternoon. They may feel tired and not that great by dinner time, and by bedtime, they may be so sick that they're in an intensive care unit on life support. Within 2 days, even if total treatment is great, with antibiotics and everything, 1 out of 10 of these children will die. So it's very severe, and even with good treatment, there's a lot of problems, death or sometimes long-term disabilities. So it's an infection that we would much rather prevent than have to treat or help families live with survivors over the years. It's not that common. There are about 1,400 to 2,800 cases every year, but it's so devastating when it happens that we think vaccines to prevent it are a really good idea. Some parents may have heard of a vaccine for meningitis that kids get when they go off to college, but now there's actually a different kind of vaccine that's routinely recommended for 11 and 12-year-olds for the preteen checkup. This meningococcal vaccine, we think, has long protection and can protect kids for the 10 or 20 years to come. We recommend it as a 1-dose shot for 11 or 12-year-olds because their risk of getting this meningitis goes up during the teenage years. They're at pretty low risk in elementary school, but once they hit the teenage years, their risk really starts to go up all the way through their 20s. So that vaccine has been around for a while. It's been given to millions of people so far, and it's recommended for 11 and 12-year-olds, and if you didn't already get it, it's recommended all the way up through age 18. So we think that at that preteen checkup at 11 or 12, this vaccine is a really good idea to keep children from getting this pretty severe life-threatening disease. The second disease I want to talk about is whooping cough. The medical term for that is pertussis, which is P-E-R-T-U-S-S-I-S. The whooping cough is one of the few vaccine-preventable diseases that has been going up in recent years. In the United States, we have pretty good control of vaccine-preventable diseases, but whooping cough has been going up instead of down. And in particular, we've recognized that a lot of teenagers are getting this respiratory infection. In babies, whooping cough can be life-threatening. They can need to go to the hospital, they can develop pneumonia, they can even die. In teenagers, it's usually a milder disease, but it's a miserable disease. When you get whooping cough, you're sick for weeks on end, you cough all the time, you cannot sleep at night because you're waking up coughing. It's a really uncomfortable condition. And it's also very contagious, so it spreads within the family. So we are recommending a booster vaccine for 11 and 12-year-olds. This is called capital T, small d, small a, small p, or Tdap. It contains components that attack tetanus and diphtheria and also whooping cough or pertussis. The Tdap vaccine is a different form of vaccines that babies and children get. When they're babies or entering school, there are other formulations your parents might have heard of, DTP or DTAP. You know, there's DT and TB. There's all these different alphabet things about this. But what we're talking about today is the teen booster. What happens is the vaccines children get when they're young start to wear off, and they become at risk for whooping cough if they don't get a booster shot. So we're really recommending a preteen Tdap or whooping cough booster vaccine. And for some of you, I think one of you was from covering Nevada also. You know, there have been a lot of outbreaks of whooping cough. There's one right this week in Nevada that is causing a lot of concern. Whooping cough can really spread through communities. So what we recommend is really trying to catch children up with the baby shots and the young child shots, but then also getting teens and healthcare workers and adults too, that Tdap whooping cough booster vaccine. Today, of course, we're focusing on the preteen years. Okay, the third routinely recommended vaccine that I want to talk about is HPV. People often have heard about this as the cervical cancer vaccine. There's been a lot of media about it, but what I want to focus on today is its use in the preteen visit. HPV is a virus, and it's a virus that we now realize can sometimes lead to cervical cancer. There's a long time between when you get infected with HPV and down the line many years ahead where you might get a pre-cancer or even a cancer like cervical cancer. And it turns out that HPV is really common. It is the chances that your daughter will get an HPV infection by the time she is 50 years old is about 80%. It's a really, really common viral infection. It's spread through sexual contact, and that's one of the reasons that the media has been talking about it a lot. But it turns out this virus also can cause cervical cancer. So this HPV vaccine has been developed and tested in a lot of people, in a lot of women and girls, and it turns out the HPV vaccine can prevent infection. If you're already infected, it can't treat an HPV infection, but it can prevent infection with some types of the virus if you are exposed to it later on. So many people think cervical cancer, adults get that, and sex, that happens when you're older. What are we doing talking about 11 and 12-year-olds and an HPV or cervical cancer vaccine? So I want to explain a little why it is that this vaccine is routinely recommended for girls at 11 and 12, so you can help explain to your readers why this is recommended at 11 and 12. It turns out that the vaccine has the best immune response. The antibodies that we make in responding to this vaccine are highest in that age group. If you compare 11 and 12-year-olds with 20 or 25-year-olds, the antibodies are better or higher in these young girls. The other thing is the vaccine works before you've been exposed to these viruses, and there are a couple different types involved. So we want to give the vaccine well before, many years before a girl is going to ever be exposed to those viruses. If we wait until after exposure to the various viruses, the vaccine's not going to have as much benefit. So the 11 and 12-year-old visit is when we recommend routinely to offer the HPV vaccine. Unlike the other two vaccines that I talked about, this one is a 3-dose vaccine. So you would make an appointment for that preteen checkup, you would be offered the meningitis vaccine and the Tdap vaccine, and then for girls, the girls would be offered the first dose of the HPV vaccine. 2 months later, she should come back for the second dose, and 6 months after the first visit, she would come back for the third dose. So it's 3 vaccines in a row to fully protect against the future risk of cervical cancer. Now, a lot of parents are a little uncomfortable with the idea of a vaccine for a sexually transmitted infection in their 11 and 12-year-old. But many parents, when they learn the vaccine is to prevent cancer, think that that's an important thing, and that it's not, the idea isn't to wait until your daughter grows up and is sexually active and all that. It's to get this protection on board well before that's even an issue. Of course, at the preteen visit, there are a lot of issues that can be brought up, helping the parent and preteens start to have discussions about some of the issues of puberty, some of the changes that the child will go through, and some of the parent-child relationship matters. One of the things we hear from parents that they have the most questions about is finances. You know, it sounds like these are bad diseases. It sounds like these are good vaccines, but I've also heard that they might cost a lot, and I really don't know how I'm going to afford them. So I want to share with you a little information about some assistance that's available for the financing of vaccines for children. First off, these vaccines I've talked about are recommended strongly by CDC and the American Academy of Pediatrics. And when the CDC and the American Academy of Pediatrics recommend vaccines for routine use in children, insurance companies almost always follow our advice. They say if the expert authorities think these are routine preventive services, the insurance companies will pay for them. But a lot of people don't actually have insurance, and so what am I supposed to do? And my child is at risk for these diseases, but I don't have any insurance. Well, there is a really wonderful federal government program that's been around since 1994 called the Vaccines for Children program, or VFC. And this program provides free vaccines to children who are uninsured, children who are Medicaid eligible, even if they never got enrolled in Medicaid, to children who are American Indians or Alaska Natives, and to children who are underinsured if they go to a special clinic, a federally qualified health center or a rural health center. So this program was set up to try to really reduce the paperwork and the bureaucracy, and when you have your child in that office with the doctor, if the child doesn't have insurance, the doctor should be able to give a vaccine for free through this VFC program. Now, there might be some special circumstances in California with additional kids that are covered, and perhaps Dr. Maslow will mention that. But the program was established because we realized there were important economic barriers in which children were being immunized. Our children were at risk, which put our communities at risk, and that was bad for everybody. So this program has really helped out narrowing the racial and ethnic disparities in vaccination that we used to have. It doesn't take care of absolutely everything, but it's a really good start and important for parents to know if they're worried about the money to call their doctor and ask about this, or even their health department for help. Most pediatricians are enrolled in this Vaccine for Children program, and so most parents don't have to take their kids to someplace special. They can stay in the medical home, stay with the pediatrician or family physician, or the place that they're used to seeing the doctor. So that's a really important thing for parents to know about. Going on way too long. The main thing to say is that as your child starts to, as your child hits 11 or 12, and you imagine the years to come, the teenage years that we all know can be pretty challenging, parents have a lot on their mind, a lot of worries. You know that you can't be by your child's side at every minute, and making sure your child is immunized is one of the things you can do to protect them when you're not with them, to keep them healthy and safe against these serious infectious diseases. So I think that's for the background. That's what I'll say, and I'll turn things back over to Steve.
Well, can you remember ever having this amount of time to hear from a doctor about what we need to know about our children's health? It's a great luxury to listen to this information, and for me it's the second day, and I'm just beginning to really absorb it and really value it. I have one quick question about this. Is there data from the Centers for Disease Control on the extent to which certain groups are least likely to have access to these vaccines, or is that something we'll hear from later? For example, Hispanics or Asians or African Americans, are they least likely?
We have looked at this a lot for the babies, for the children in the toddler age group. So we track nationally and state by state immunization in that 2-year-old period. And what we found in the past 10 years is a great improvement in immunization with the recommended vaccines in blacks and Latinos and Asians compared with whites. So the gap that we used to see in coverage of the routine vaccines for babies has really started to narrow. On the other hand, there are some newer vaccines that racial or ethnic minorities may have lower coverage of. And those are important concerns that we have that we've been tracking in the babies. Now in the teenagers, this is pretty embarrassing, but the CDC hasn't had strong tracking of teen vaccine coverage. We've done some surveys and we have some data, but we didn't have an ongoing, every year, every state way to know what was going on with immunizations in teenagers. And so we have tried to fix that problem. And in 2006, we did our first national snapshot of children at 13 to 17 years of age. And in 2007, we are introducing an ongoing, every year, every state survey. This is something we call our National Immunization Survey. And instead of just targeting the 2-year-olds, we're going to look at the teenagers also. The survey is very large, and it involves calling people and then following up with the doctors to check the vaccine history. Because you can imagine it's hard for parents to remember exactly everything that the child got. So we verify with the doctor's office the record. We don't verify to figure out, is this child allowed to be in the country? We're just checking the vaccine history. We're not going into anything besides the health matter. And so we hope to know how we're doing. The reason that we're launching this preteen vaccine campaign and that we're reaching out to all of you is we don't want to have a 10-year lag between people who are in the majority population having the vaccines and other groups not getting them. We want to get the information out right away. So we're trying to launch this campaign with a special outreach to the minority media because in the past we have seen delays and gaps, and we know people seek information in different places. So that's sort of one of the reasons we're here.
Thank you.
One World Org, promoting cultural understanding through the media.
Guest is Dr. Charles Wittelsman, and as you will note from the press packet, he is the Chief of Adolescent Medicine for Kaiser Permanente in San Francisco, and he also serves as Chair of the Chiefs of Adolescent Medicine for Kaiser Permanente throughout Northern California. He's also an author, and the book that you're credited with in your bio, and there may be others, is the Teenage Body Book, Growing and Changing, Life Happens, and Crisis Proof You're a Teenager. Can you come to our house virtually? It's great to have you, Dr. Wittelsman, and you're going to talk about...
Thank you. Well, I'm honored to be here. I am representing the American Academy of Pediatrics. I'm on the Committee on Adolescents, and really want to talk a few minutes about really the preventive health visit of the young adolescent. For all of you who are parents or have nephews or nieces, you probably realize that you have a child that you bring to the pediatrician and you come there and you walk in with their hand. Well, when they're 11 and 12, they don't want to hold your hand, and they're also, it's time for them to really be on their own. Preventive health care is critical for at morbidity and mortality. What are these kids dying of? At morbidity and mortality, what are these kids dying of? They're dying of accidents, they're dying of homicide, they're dying of suicide. And what we can do as pediatricians is when they're there, get them in and sit down and talk to them and their parents about all these issues in life that maybe they haven't been thinking about. You know, when we're talking about the immunizations, you know, we give a shot to prevent the disease. But the best shot that we as pediatricians can give them is to sit down with the preteen and their parent and talk to them about safety and their health. There is a real gap. I think all of us know, well, when did you have your last shots? Oh, it was when I went to kindergarten in the first grade. Well, what about since then? Well, I don't know. Well, when did you see the doctor again? Oh, well, when I had a sore throat, when I sprained my ankle. And if you look at some of the data that just came out, I think it's in your packet, Jonathan Klein, who's the chair of the Committee on Adolescents at the American Academy of Pediatrics, they looked at preteens, how often did they come to the doctor? When you looked at the number of visits over a previous year, only 9% of all the visits to a hospital or to a clinic really had to do with preventive health. Somebody coming in for what we call the checkups, the physical, etc. The rest of the times we're just in for urgent care. When you go to the emergency room because you may have sprained your ankle, nobody's going to sit down and ask you about, do you smoke? Do you use drugs? Are you sexually active? That's not part of the urgent care visit, even though we might want it to be. What we really need is this opportunity for the 11 and 12-year-old to come to see a provider. And when you look at the data, who provides the care to an 11 and 12-year-old? Pediatricians, family practitioners mainly, who are taking care of these children. And our colleagues, the 60,000 of us, pediatricians all around the country who are with the American Academy of Pediatrics, this is our mission, to get these 11 and 12-year-olds in for what we call an anticipatory preventive health guidance visit. This is the time when you want to really sit down and acknowledge the fact that this 11 and 12-year-old, as you may well know, sitting around this table, there are many young women, especially the minority, African American, Hispanic, 11 and 12-year-olds are already having menstrual periods. They're already sexually reproductive. And again, now is the time to really sit down to talk with them and their parents about issues of their health. Because a lot of times it was like, oh, well, you brush your teeth. You know, that's really important. But somebody really needs to talk about accidents. Do you wear a seatbelt in the car? Do you wear a helmet? These are issues that many pediatricians of my colleagues, we often didn't even ask. Well, you look fine, here's your shot, and goodbye. And you really need to talk to the parents and the adolescent about their daily activity. Nutrition is extremely important. You know, when you look at the epidemic of obesity, I'm sure you've written about this a lot, here in the United States, no matter what ethnicity, many of our children, 11 and 12, now are being diagnosed with type 2 diabetes because they are so overweight. Because nobody has really sat down with them and said, hey, you shouldn't be eating this. You should get more physical activity. Even here in California, where we think, oh, look how sunny it is all the time, and everybody's outside playing. And that's not true. We're not getting physical activity. So the preventive visit for the pediatrician to sit down and talk with the 11 and 12-year-old about his or her own health, about making choices, because now as they're going, one of the most interesting comments that I've ever had is where a mom would say, you know, now that my son or daughter is a teenager, I don't know him or her anymore. It's a different person. And it's true, they are different people. They're becoming their own person, and they're making their own decisions, they're making their own choices. Middle school, the 11 and 12-year-olds, this is a very difficult time for them. There's so much harassment, peer pressure. The organization that I work for in San Francisco, Kaiser Permanente, we have an educational theater program. Actually, we have 5 of them. One is on peace signs, on violence prevention, and the other one is on Nightmare on Puberty Street. And Nightmare on Puberty Street is just for preteens, and what we're talking about is we're talking about peer pressure, parental expectation, low self-esteem. These kids are very critical. When you talk about the book that we wrote, Growing and Changing, changing is the real issue. You're going from a child to an adult. For these kids, their own self-esteem, their own self-image is very, very tentative, and they feel very unsure. These kids need a lot of reinforcement. They need a lot of support. And we as pediatricians, as parents, this is a very special time. When I asked some of my teenagers, well, what was the worst part of your life? What do you think the answer was? Middle school. That is the most difficult time to go through. So these kids really need special care. Somebody needs to sit down with them and talk to them about preventive health, what they can do, what they eat. You have to look, if you look at statistics from the CDC, the Youth Risk Behavior Survey, I don't know if that's referenced in our handout, but the Youth Risk Behavior Survey, YRBS, published last year in 2006-2005. It surveys high school students all over the country, every city, every state. You look closely at the details of that, and you look at 12-year-olds, almost 10% of 12-year-olds are actually admit to having sex. And that's kind of scary, isn't it? So we're not missing the boat. Now is really the time that we need to sit down with the 11 and 12-year-olds and their parents and talk to them about their life and what they're doing, and to reinforce the immunization, but also to make sure that they do come back. One of the recommendations of the American Medical Association is GAPS, Guidelines for Adolescent Preventive Services. American Academy of Pediatrics has Bright Futures. Again, the recommendation is that all adolescents should have an annual preventive health care visit. So many times you talk to kids and say, oh, when was your last physical? Oh, I had a sports physical. Oh, where was that? Oh, that was in the locker room. And what did they do? Oh, well, they listened to my heart, and they made me cough, and that was it. And like nobody, you know, like there was 100 kids in a locker room, and that was it. Nobody talked to them about, do you wear a seatbelt? Do you wear a helmet? You know, are you smoking pot? Those kind of things. Alcohol use. So all of these, this is a wonderful opportunity when you couple the preventive health visit with these immunizations, which just as critical. It's like the perfect marriage, and this is why we really need to get this message out to parents, whether you're whatever minority, whatever your ethnicity is, to realize how important this is. And I just want to finish up by telling you a little bit about my own personal experience in San Francisco, because in my own practice, it's very diverse. It's 25% Asian, 25% African American, 25% Hispanic, and 25% Caucasian. In my own experience, unfortunately, many parents assume going to the doctor means something is wrong with you, something is bad. You have to be sick to go to the doctor. And people don't realize that going to the doctor is healthy, and that's just part of normal living. It's good to do this. You don't have to be sick. It's not a stigma that something is wrong or to be ashamed. And that's what we really need to get out and say, you know, go to your pediatrician as an 11 and 12-year-old, get the clinical preventive visit, talk to the pediatrician, and get the immunizations. So I think I've said enough.
Finally, we have from the Centers for Disease Control and Prevention one of the key people in charge of communications. And her name is Carrie Sapsis. She is a health communications specialist with a special focus on preteen vaccine campaign, the preteen vaccine campaign that we're all here today to learn about. And she has been with the CDC for over 10 years, working in the public health communication and social marketing field. So, Carrie, we're glad to have you here and your thoughts, and then we're going to turn it over to really open this up for discussion and questions. Thank you.
I want to talk to you today a little bit about how CDC developed this campaign and then about the campaign elements, so you can share that information with your readers. So as we were developing this campaign, we took time to go out around the country and talk to the parents of these 11 and 12-year-olds. In December of 2006, I developed a focus group plan, and focus groups are where we take time to talk to our target audience. In this case, it was the moms of the 11 and 12-year-olds, because usually the moms are the ones who are in charge of the health care of their family. And we went to 3 cities. We went to Dallas, Oakland, and Philadelphia, and got these moms together in groups, and they were predominantly African-American, Caucasian, and Hispanic moms, and we're going to be expanding that during the next year, but so far that's who we've talked to. And we did 35 focus groups with them, and we talked to them about the 3 vaccines that Dr. Schuckett mentioned to you, and we wanted to hear from them what they knew about the vaccines and about the diseases and what they wanted to learn about, what information they felt they needed so they could make healthy choices for their kids. We also pre-tested some educational materials with them. We showed them some flyers and some posters and found out what they liked about the information, what they found confusing, and what they would suggest that we change. We also asked them where we should deliver information to them, who they trusted as a source of health information, where they went for health information, so we could make use of their sources. And of course, they told us that they use folks like you for information, and that's part of why we're reading with you today. And then we also wanted to make sure that really that our messages were salient. In other words, that they really resonated with people, and that they would get folks' attention. Because we knew that, for example, as Dr. Wibbelsman said, a lot of this information is really not on a parent's radar screen. They don't always think about preventive health. They're 11 and 12-year-olds, because most of the time, most 11 and 12-year-olds are pretty healthy. And so we wanted to figure out, how could we make this seem like it's an important issue to these parents? So first, I'd like to talk to you about what we found out about the human papillomavirus, or HPV vaccine, and then I'll talk to you a little bit about the other 2 vaccines. So first of all, parents knew a little bit about this human papillomavirus, or HPV, mostly because there have been a lot of television advertisements. Many of you have probably seen or heard something about the vaccine that's come out recently for HPV, and a lot of these moms had as well. But they were still pretty confused about it. For example, some of them knew that HPV is a virus, but they were still a bit confused about how a virus could cause cancer. That's a pretty new concept to them, and so they asked us to try to explain that to them more. And some of them were confused about how there could be genital warts and cancer that are associated with this virus, and what did that mean, and how does that relate to the vaccine. And we wanted to know if they were confused about the initials HPV and HIV, which is what causes AIDS, and whether we needed to explain anything about that. And actually there was very little confusion about that, which was good, because there are a lot of other things I need to explain, and I was glad not to have to explain that. And then a lot of them were familiar with, like I said, the television advertisements and some of the slogans that are out there, which was somewhat helpful because they had an initial familiarity with some of the terms, which meant that CDC didn't have to kind of do some of that very basic educating on some of the terms, but that we could take it the next step. So that was interesting for us to know. We learned that really most of these parents had not heard about this preteen health visit. They hadn't heard about the need for this 11 or 12-year-old vaccination. They didn't know what age their children should be getting this HPV vaccine, and they didn't know that the HPV vaccine was just for girls right now. They weren't really sure who should be getting it. A lot of confusion about the ages and the girls versus the boys and things like that. So I knew that we would need to address that in our campaign. With regard to the pertussis or whooping cough vaccine and the meningococcal vaccine, we learned that some of them still remembered from when their children were babies, the TD and the DTP vaccines, but they really did not know what this Tdap was, that the 11 and 12-year-olds should be getting. So we knew we had to teach them about the fact that the 11 and 12-year-olds needed this booster shot. And we needed to teach them also that, as Dr. Schuckett said, that the immunity from when their child got vaccinated when they were a baby, that wears off. And when we told them that, they were very intrigued by it, and it also served to motivate them to get their child vaccinated at age 11 or 12. So I encourage you in your stories to educate the parents that you're talking to and let them know that the baby vaccines can wear off and that it's time for their child to get vaccinated again at age 11 or 12, because that's something that really concerned these moms and made them want to get their child vaccinated again. With regard to the terms, you heard Dr. Schuckett use the term whooping cough instead of the term pertussis, and that's really because we found that almost none of these moms really knew what pertussis was. And so in our materials, we're trying to teach moms that pertussis and whooping cough are really the same thing. Most of them know, though, whooping cough, they remember that term. So you may want to try to teach them, too, in your articles that whooping cough and pertussis are the same thing. One's just the scientific term, and the other one's kind of the general layperson's term. And then there's that funny word, meningitis or meningococcal. And they all hate it. When they read it on our flyers, they all hated it. They said, could you take that word out of the flyer? I don't like to read it. A lot of them were really unfamiliar with it. And those who had heard of it still thought that you really only need to get it if your child goes away to college or goes into the military. And so we realized that we really need to help parents understand that now you give it at age 11 or 12. You don't wait until a child is 18 or until they go to the military. And so again, I encourage you to educate parents that age 11 or 12 is really the time that all children need it, not just children who go to college or to the military. And that this disease is really, really serious. And one thing we found with the immigrant moms who were Hispanic was that in their countries, they really just had not heard of meningitis. In fact, when they read our descriptions of some of the things that can happen to a child who gets the disease, for example, losing a limb, they thought we were talking about tetanus. They said, oh, they must be confused. They're talking about tetanus. And so we realized that perhaps in their countries they hadn't heard as much about this disease. So again, I encourage you to describe to your readers that this disease, meningitis, does exist, that it's very serious, and as Dr. Schuckett said, it can strike a very healthy child very quickly and be incredibly devastating. And that here in the United States, we are able to prevent this disease, even though maybe in the countries some of your readers come from, maybe they can't prevent it. And so this is a great vaccine, and it's really exciting that here in this country we can prevent it. And so as part of this campaign, we are promoting that third vaccine, the meningococcal vaccine. So what do we have available for parents as part of this campaign? Well, we have educational flyers, and those are available. They're in your packet, so you can see them. They're in English and Spanish, and in the coming months, we'll also be translating them into some other Asian languages. We also have posters available, and there's some samples of the posters around the room. They're all available for free for download from our website. The website is on the bottom of all of the flyers and posters if you'd like to go look at those and get more copies of them. And then we've also got a website for parents, so parents can come and look around and get more information before they go talk to the healthcare provider or after they go talk to the healthcare provider. And then we're doing direct mailing to over 150,000 doctors all over the country, to the pediatricians and the family physicians that Dr. Wigglesman talked to you about, those very doctors that are serving all of your children and the children from your communities. So they'll all be getting information about the campaign materials and about all of these vaccines, and a letter from Dr. Schuckett telling them about the campaign and really encouraging them to give all of these vaccines and to do these health visits. And then we're doing meetings with mainstream and minority media like yourselves in New York and here, and we're doing radio tours and other things like that to really work with the media that parents listen to try to get the word out to all of them. So we're going to be available here to talk with you, and in the future, if you're doing stories, back to school or just throughout the year, and you would like contacts about any of this, please feel free to make use of us. And as these folks said, they're here from the local health department and always willing to speak with you. Thanks.
Well, thank you so much. It was a great. How do you get meningitis? Where does it come from? it's always been this very scary thing that if you have a headache, maybe, or your kid has a headache, maybe you're getting meningitis. But I don't have a clue how you get it.
Yeah, you know, the bacteria that causes meningitis is carried in our nose and throats, and we don't even know it's there. And most people are fine; they don't get sick from it. It's spread by respiratory transmission, cough or sneeze, or through respiratory droplets. And some people, when they get exposed to it, instead of just having it in our nose and throats and not having symptoms, develop that life-threatening meningitis. So there's not, it's not sex or food or some kind of odd behavior. It's really just breathing.
So you just have no, it's totally random.
Right, and so we do know that in the teen years the risk increases, and that's an important thing for people to know.
And Julian, coming from the Vietnamese community and with your own two children approaching this age, do you have any last questions?
No, just an observation. I'm glad I'm part of this since there's so much information out there that I consider myself somewhat on information on health, but don't really know that I should. And I think someone suggested earlier about a list of questions that for next time,
to the doctor. Yeah, good point.
No,
this is very helpful.
you could be very embarrassed to bring up sexuality, sexual issues with your children, but if you say to the doctor, could you please discuss these issues, they can break the taboo easier than you can.
And a lot of parents ask for that. Will you talk to my son or daughter, especially if it's a single parent, can you talk to my son or daughter a little bit about puberty and about sexuality? And I'm happy to do that. Because of course the kid's living with his mother and doesn't know his father. Who's he going to ask these questions? Where's he going to get reliable information? From the internet, from movies?
Can you do a favor for the parents and the kids with your PR to say, like when they talk about smoke, no sex for this age at least, then you talk about your message, because the kids will take the message first and go for it as something acceptable. Right. That's why maybe the rape and the molesting things become more normal for the kids to hear it, not as a problem. So this is dangerous to have that message clearly loud for the parents and the kids with the protection, but not saying, no, for this age, it is not good for you to begin with, then talk about the subject.
Yeah, and one of the reasons we talk about the immunizations in the context of this preteen checkup is you need to talk about all of the behaviors that are happening. You can't talk about, it's like a society where you think you can take a pill for everything. We need to start talking about how we live and the risk that we take and what are the right activities.
Well, let's, again, we want to thank you, and please, can you stay for a few minutes of one-on-one?
Okay. Yeah, I'm Dr. Ann Shookett. I'm director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC. We're talking to people about preteen immunizations and the importance of getting a preteen checkup. Most parents don't realize that immunizations don't end when your child enters elementary school, but they go on. And when your child is 11 or 12, they really need to make a doctor's appointment for a preteen checkup so they can get immunizations, but also talk to the doctor about a lot of other things, the issues that are going to be important in the next several years as your child develops and grows. There are 3 vaccines that are available at the 11 or 12-year-old visit. One is a meningitis vaccine that protects against a life-threatening cause of disease. A second is a booster of the tetanus, diphtheria, and whooping cough vaccine, because protection wears off against those diseases when a child grows, and the baby shots aren't protecting children anymore by the time they hit their teenage years. So a whooping cough booster is recommended when a child hits the age of 11 or 12. And the third recommendation is for girls who are 11 or 12, and that's for them to be offered a cervical cancer vaccine called HPV that prevents the development of cervical cancer in the decades ahead.
The other important piece of information for parents is that economics or financial concerns shouldn't keep them from getting their children vaccinated. There are programs to make sure that children who are uninsured are able to get vaccines for free. There's something called the Vaccines for Children program that entitles all children who are up through the age of 18 who have no insurance to get vaccines for free. So it's so important that we can try to protect our children, and we shouldn't let money get in the way of it.
Post office, they work for the county, they come in, they have good insurance.
It is something we didn't know before, and it's hard to believe that our preteen, those days, doing things above and beyond our thoughts, maybe, or our thinking of our kids. And we have to be prepared in any way. We have to accept the fact that we live in the 21st century, but we have to double our duty, taking care of our kids, educate our kids about wrong and right, good and bad, and build up their thinking the right way from home, not from the street or from friends.
My name is Charles Wibbelsman. I'm with the American Academy of Pediatrics, and I'm also with Kaiser Permanente. I'm in adolescent medicine. And the message today for our press conference is for parents to bring their 11 and 12-year-old sons and daughters to the doctor for a preventive visit, and for the 3 immunizations that are now recommended for this age group. Not only are we giving these children shots that will save their life, but we can also sit down with 11 and 12-year-old and the parents and talk to them about preventive health, about things that they can do to save their life, wearing helmets, seat belts, talk about nutrition to deal with the epidemic of obesity. There are so many preventive things that we can do as parents and as pediatricians to save our sons and daughters' lives. And if we don't sit down and talk with them, and if we don't sit down and talk with them alone, it's very important that now, even though we used to take care of the child and sit in the room, now it's time for the pediatrician to spend a few minutes alone with the 11 and 12-year-old and talk about some personal issues. We also want to emphasize that the 11 and 12-year-old, as they're growing up, they're going to be making decisions on their own. These need to be responsible decisions. And I think that it's important, and when we look at the statistics around the United States, we do know that young teens, as young as age 12, are now having sex. Some surveys show as many as 10% 12-year-olds in the United States are having sex. So this is happening. We need to talk to these young people about this. We need to give them the message. We need to say, you know, that you make choices and you need to protect yourself. You do not have to have sex to be normal. It's very important that these kids have good self-esteem, that they feel good enough about themselves and their self-image that they can say no, and that they should, again, 11 and 12-year-olds are under an incredible amount of peer pressure to do things that they may have even thought they not wanted to do. And again, you know, parents need to send standards for their children. You know, this is the model, this is what we recommend. And the children need to understand, you know, what the standards are from the parents and to lead good lives. Just that, again, children have so many influences from their peers, from their parents, and what they see with adults. So if a father smokes, how can he tell his adolescent not to smoke? If a father or mother is not leading the ideal life, you know, the parents have to be role models for their children. They have to set the standards. And they also have to make sure, they have to know who their adolescent's friends are. Who does your son or daughter hang around with? Who do they spend time with? We need to monitor that. We just can't say, oh, they're over at somebody's house, but we don't know that person. We don't know their parents. You know, that's very high risk. We need to know where our children are and who they're spending time with. We need to know their siblings. We need to know their friends. We need to know the parents and where our children are, especially in the evening and the weekend.
The parents should be responsible for their kids.
That's right.
This is their duty.
But unfortunately today, you know, especially here in the United States and California, both parents are working. They're not at home. The kids between 3, 5, and 6 in the evening, they have no supervision. They get home from school, nobody knows what they're doing. They have no guidance, you know, the latchkey children. And so it's really important that parents know where their children are and who their children are with.
Thank you. It is something we didn't know before, and it's hard to believe that our preteen, those days, doing things above and beyond our thoughts, maybe, or our thinking of our kids. And we have to be prepared in any way. We have to accept the fact that we live in the 21st century, but we have to double our duty, taking care of our kids, educate our kids about wrong and right, good and bad, and build up their thinking the right way from home, not from the street or from friends.
Michelle Parra, I'm the director of the immunization program for the Department of Public Health here in Los Angeles County, and we are very excited about our preteen vaccine message. We're having a preteen vaccine week in January of 2006, from January 20th to 26th, where we're going to promote preteen vaccines. And also for the Los Angeles area, I wanted to also get the message out that vaccines are available for free for people who are uninsured. And they can be, you can access the, it's an 877 number, but it's 877 to get VFC. So it's to GET VFC. I'm not sure what the numbers are, but it's a program for uninsured individuals who are under the age of 18 for free vaccines. You can also call the local health department, or you can call the immunization program. Our number is 213-351-7800. But we are very, we want parents to really be aware that it's an important message to give your teen or preteen that these vaccines are important, and they can go to their pediatrician and even ask for them. You don't have to wait for your pediatrician to recommend it.
Is there any way to talk about the problems a teen will face if they didn't take it?
Well, they will be more susceptible to the diseases that these vaccines prevent. So we want to keep everybody healthy. The department, our mission in the Department of Public Health is to keep people safe from and free from disease. So this is a preventative measure, and so we. It's very important because vaccines are, we're very lucky to have them, and a lot of people in the United States don't realize how much disease there is when vaccines aren't available. So it's a preventative measure that is very important.
So it gives more immune to the system?
It creates an immunity to the diseases, so it prevents them because you're becoming immune to them.
Thank you. We came to the end of the show, and we'll repeat the message for the last time and let you think about it and go for the centers wherever there's help for you or your kids, and check with your MD doctors, and check with the information around you, get some knowledge and use it for your own benefit and for your own kids' health benefit. Thank you, my viewers. We'll see you next time.